This is a female ultrasound, obstetric ultrasound referred for large dates and to rule out any fetal anomaly. She has 2 kids which are normal. No history of cesarean. So here what we are seeing is the cervix of the uterus. Now this is the cervix of the uterus, this area. And this central echogenic line that you are seeing is the cervical canal, which is closed, and this area is that of the internal os, and the placental margin is placenta. This is the posterior placenta, low lying and marginal, in a sense that it's only 45 millimeters away from the external internal os. This is the internal os. This is the placenta. And this is the amniotic fluid. We must see the the length of the cervix. This is the 45.7 millimeter is the, rather I should take it up to this level, 40 millimeters. The distance between the internal os, this region, this being the cervix, and this being the lower end of the placenta. This is the placenta. Is approximately 40 millimeters, and the length of the cervix is 37.6 millimeters and is within normal dimensions. The minimum acceptable cervix length is 25 millimeters. Now you see that the biparietal diameter is 7.94, which corresponds to the gestational age of 31 weeks, 6 days. Female length is 5.78 millimeter, corresponding to the gestational age of 30 weeks. Head circumference is 286.8 millimeter, corresponding to the gestational age of 31 weeks. Plus 4 days. Occipitofrontal diameter is 102.9 millimeters, which corresponds to the gestational age of 31 weeks plus 3 days. Gestational age, calculated gestational age is 31 weeks 2 days, and the expected date of delivery is 16th of December 2012, with posterior low-lying placenta So after having done this, let us see the little bit of the placenta. So you see that it is posterior wall, and the grade of the placenta is grade 3 placenta, 2 to 3 rather, I will say. These are the condylons. The placental legs, and these are the ectogenous stitches along the chorionic plate. This is the placental substance. There is no calcification in it, and in this region we see no calcification. So this is grade 3 placenta. Grade 2 to 3 placenta. Posterior wall and marginal. Now if you see that there is a significant amount of fluid, with that corresponds with the definition of hydramnios. The placenta is still, you can trace it down here up to the cervix. Low-lying placenta, posterior wall with hyperactive fetus that you will see with the passage of time, as I will show you later on. But first of all, let's see how much the largest amniotic fluid pocket measures, excluding the umbilical vein. Now you see it measures 18.8. This is the amniotic fluid pocket. Amniotic, largest rather single largest amniotic fluid. This is the amniotic fluid. Pocket, and you see it measures 18.8 centimeters and is fulfilling the criteria of polyhydramnios. So first finding we have seen that is the placenta is posterior wall and marginal. Second, we saw that we have seen that the patient has hydramnios, polyhydramnios. Now let's try to rule out some of the important major causes of polyhydramnios. Let us see the kidneys. Now you see that this is the kidney, this is the kidney. This is the kidney. I am going to measure it. 3.8 centimeters in length and to 1.9 centimeter in anterior-posterior diameter. The kidney is normal. This is the spinal cord that you are seeing, and let's see if there is any anomaly relating to the now this is the femur. This is the femur, and this is the femur. This is the sex of the patient. Now the fetus, it is a penis. Now you see that this is the penis. So it's a male fetus. And this is the scrotum. This is the scrotum. And here we see scrotum with testis, scrotum with penis. You can see that the fetus is very active. Now these are the thighs, this is the femur thigh, and this is the scrotum, this is the penis. So a male fetus, the bones are normally calcified. There is no curve seen with the bone, relating to the bones. Now the umbilical cord, you can see that the umbilical cord is 2 arteries and 1 vein. 1 artery, second artery, and this is the vein. So the umbilicus is normal, and the umbilicus measures approximately 11.6 centimeters, whereas this is the umbilical cord, this one, umbilical cord, and in this it measures 11.6 up to 8 centimeters is acceptable, and above 8 centimeters is considered as normal. So this is normal length of the umbilical cord, having 2 arteries and 1 vein, which is the requirement for a normal umbilical cord. So the umbilical cord is normal. This is the neck of the fetus. Walaikum Assalam. मैं सोच रहा था आया नहीं आज शायद. And this is the vertebral column. So from cephalic to caudal end, we do not see any outpoaching or any anomaly. This is the stomach bubble. This is the fetal abdomen. This is the transverse section of the fetal abdomen. This is the transverse section of the fetal abdomen. This is the liver, the gallbladder, the hepatic veins. Here we can see the second kidney. This is the second kidney, fetal kidney. So, and this is the urinary bladder. Now let's come to the chest. The chest is normal. Cardiac activity is, now you see that here you can clearly see that this is the diaphragm, this is the liver, this is the gallbladder, this is the portal vein radicle. The reason being that the margins are, with the margins you can see echogenic area. So this is the liver with portal vein radicle, and however this can be a CBD or a portal vein. This is the heart, this is the diaphragm, the lungs. So the chest is seen normal. The cardiac activity four-chamber view. It becomes difficult to go along with the fetus when there is polyhydramnios with hyperactive fetus. So the major cardiac activity ranges between 141 beats per minute with regular waveform. So see that the waveform is regular. Now I'm going to scan the fetal skull and head, neck region, face, because that is any anomaly in this region is a major cause of polyhydramnios. The presentation is cephalic, as you can see that the head is near this, just above the symphysis pubis. This is the head of the fetus with now this is the cranium, the skull bone, normal, and this is the fox cerebri, this line. These are the cavum, septum, pellucidum. This is the thalami, and there is no dilation of the ventricles. All the internal organs of the brain are seen normal. This is the neck of the, this is the neck region. And at this region we do see an anomaly. This is the fetal face. This is the eye, and these are the facial features. Which are normal. No anomaly is seen relating to the fetal face. I see that there is another eye. The second eye is also visualized. See the activity of the fetus. How active the fetus is. See the limb movement. Here you can count the fingers. Here. 1, 2, 3, 4, and the thumb. This is the palm of the hand, wrist joint. So this is the hand of the fetus. And these are the fingers. This is the mouth of the fetus, mandible. Here I am short of gel. Head of the fetus. Here we come towards the spine, the neck region, and in the neck region, between the neck and the cephalic portion of the head. Now, this is a solid mass. Seen at the neck region. This one. This is a mass measuring approximately 4.2 into 1.91 centimeters. This is the neck of the fetus, and from here you see this is the cranium, and this is the from where the chest starts. So there is a definite, solid, echogenic, well-demarcated mass at the fetal neck region. Now, this can be, it appears to be a thyroid mass. However, the differentials will be significantly much more. See again here. Now, I wish to show you the brain, the mass, and the chest together here. Here we are. Now you see that this is the cardiac activity of the patient. This is the heart of the patient. You can see the cardiac flicker. And this, even here you can see the cardiac flicker. And it is, the mass is too. There is a central echogenic tubular structure, which is a vessel, pulsating vessel, passing through this neck region and entering the head, and from here it is entering the, this is the superior vena cava, and from here it's entering the mass. Now this is the mass with a large vessel passing through it. Now in this region it measures, in the neck region, approximately 36 by 32 millimeters or 3.6 by 3.2 centimeters with this vessel, the superior vena cava most probably, and this is the covering of this mass, solid, echogenic, evenly echogenic. It is evenly echogenic, and there is a covering around it, with this being the head of the fetus, this being the chest or thorax. Most important, most common in this region, at the neck region, are the cystic hygromas. But the cystic hygromas are always cystic in nature, with peculiar septations in it, if there is any. And secondly, it can be a teratoma in the neck region, but the teratoma also has a very peculiar shape. It rolls out. It's not evenly echogenic as we are seeing this area to be. And it has a covering around it. This covering suggests that this area, this is the head, this is the brain. So now this covering, this is the covering, and this is an evenly echogenic mass relating to the fetal neck and neck region, that too anteriorly. Mass is anterior to the neck. This is the head, fetal head. So there is mass. Now I will show you with this curve. And here I will show you with it relating to the chest, trachea. This is the neck region. This is the posterior portion of the neck, posterior neck region. And this is the anterior neck region with two lobes. You can see, you can identify two lobes. Okay, we will study it later. Let me show you this pathology with the chest. Here you see. You can very well see the pulsation in these vessels. Here comes the heart. And this is the mass. So this is the part, these are the vessels, and this is the lobe of the segment. This appears to be posterior lobe of the mass, and this appears to be the anterior part of the. So bilobe mass can be a thyroid mass. So my finding will be mass relating to the anterior portion of the neck, anterior neck region. Now this is the heart, this area. This is the brain. I am saving the image for further study for myself. Now, I am going to magnify this mass, and then I would like to study and see it's a bilobe shape of a mass with a vessel passing through the center of it. There we are. I am giving a full sweep to the mass to see if it changes its shape or no, it remains the same. There we are. Difficult ultrasound scan to perform. But now you see this is the evenly echogenic bilobe mass with a vessel in the center of it, passing through the center. This is the main vessel, and to me, if I am not wrong, it appears to be superior vena cava. And this is the mass. This is the mass, this area, evenly echogenic. This is area, evenly echogenic, relating to the fetal neck region, because from here onwards the brain and head can be seen, and this is the heart. So this is the central area, the neck region, between the head and the neck. In this location, if you measure the lobes separately, the measurements are in longitudinal section, both measure 2.8 centimeter. In anterior posterior diameter, both measure approximately 11.8 millimeter. So the dimensions of the both masses are the same. The dimensions are same, they are well demarcated, they are evenly ecogenic. Even in this case, you can see it's evenly ecogenic, well demarcated. There is no calcification seen within it, within this and this mass. And there is a vessel that is traversing through the center. It can be, if it had been a trachea, then in that case we should have been seeing air from this and the air shadow. There is no air shadow seen in this region. So this is a vessel emanating, entering the heart. The bilobe, evenly ecogenic mass with no calcification or any cystic area within it. And this is neck mass, neck region of the neck. So this is the main issue in this. The cause of polyhydramnios is this solid, evenly ecogenic, well demarcated mass relating to the anterior neck with vessel traversing the center, having no calcification, with no shadowing, no cystic area within it. There is no cystic area seen within it and is well demarcated. And this is the reason for the fetal activity that we saw patient was showing her. Seeing the fetus to be much active than expected normal. This is the head, again a review, a short review, the mass, the head, the bilobe mass, the chest,